Georgie, thank you so much for being here. I am so excited to have this conversation. I'm honored that you're taking the time to share what you do with my audience. Would you do the honors and just introduce yourself?
Of course, yeah. So I'm Georgie Oldfield. I'm a physiotherapist based in the UK. And in 2010, I set up SERPA, which is Stress Illness Recovery Practitioners Association, which was built on the work of Dr. John Sarno when I came across his work in 2007. And I was very isolated over here in the UK, kept going back to America, where a small group of us were starting to really work in this field. And it's evolved since then, basically. So I really now run a training organisation.
All right. Tell us what SERPA stands for and the overview of the services that you provide.
Well, it's Stress Illness Recovery Practitioners Association. And actually, that's really just, we came up with that name back in 2010 when we set up SERPA. And it's really a training organisation for health professionals and coaches so people who are already qualified and working with clients. So it could be doctors, physios, osteopaths, psychotherapists, counsellors, and coaches as well. And basically teaching them how to integrate a mind-body approach within their own work, predominantly with chronic pain, but also the numerous other mind-body or neuroplastic conditions that we know are around.
Yeah. So let's go back and just tell the story of how you came into a mind body approach. You started as a physiotherapist treating patients and clients recovering from illnesses or pain of the physical body, knees, neck, back, hips. What caused you to expand your perspective? What did you find and what did you notice?
It was questioning more than anything the anomalies that I was seeing with clients. I trained quite a long time ago now. Initially went into respiratory care, became a specialist in respiratory care, which actually comes in well in my work now with breath work because we include that in our work. And then really just I started my family, I went part-time, I began working in different areas within physiotherapy and started to become really interested in treating people with pain, but also, like many people, getting very frustrated with trying to help people with chronic pain, where all we believed we could do was help people manage chronic pain. And I kept thinking, this is not right. There must be more that we can do for people who are living with chronic pain, either from the start so they don't go into chronic pain, or whatever age they were. It just seemed a bit ridiculous that we couldn't do more than help them manage the symptoms. And then I interestingly started using some alternative therapies like acupuncture and reflex therapy for spinal pain, as well as something called neurostructural integration technique. So it basically, I think, opened my mind up to more about the whole body is involved here, and then began to realize that there was much more than that, actually. And I was just questioning why people were coming to me, for example, saying that they'd had chronic pain for years, but they'd never had an injury. So they blamed it on, they said maybe they woke up one morning and then 20 years later they've still got pain. It just didn't make sense on a physical side.
I know at this point being over 50, my favorite injury is like, how'd you hurt yourself? Oh, I was asleep. Yeah.
Yes.
How I
Yeah.
did that.
I
Like,
woke up and turned over.
I don't have a good story. So I certainly understand, and then I'll go into periods where my back hurts or my hips hurt or whatever. But you've told a story that I've heard a lot about you speak on other podcasts, and I think your TED Talk as well, where you share that somebody asked you one question and it was, what's going on in your life? Can you say more about what that one question? I'm a coach and I feel like my superpower is asking the right questions and cracking open a whole new reality or awareness. So can you speak to that question and what was going on for you and what that led to?
Yes, well, that first time was really when I had left the National Health Service. So I don't know, over 25 years, I think, have been working in a paid job in the National Health Service. And because I was getting frustrated with what I could do within that service, with what I was learning, I decided, and the clients that I was working with there, I decided to go privately and set up my own private practice. Um, and then I wish I remember, but I don't. I can't remember how long after I set up my business that I woke up one morning with severe sciatica. So pain down my leg. I'm a physio. It's because I must have rolled over badly in bed, or I must have twisted or something. Those are my thoughts. My children were having to put my shoes and socks on for about 3 weeks. Nothing was helping it. And then luckily I had heard about this practitioner who happened to be a craniosacral therapist. Um, and I remember just going to her and explaining the situation. And the first thing she said was, "So, what's going on in your life?" And I thought, well, I knew that I was stressed, but what do? We shove it down. No, I'm fine. I'm running my own practice. I'm loving it. It's wonderful. Lost my salary, lost my pension, well, any further pension, and my husband's self-employed. So I was stressed. I knew I was breathing very fast and up here quite a bit of the time, but I was outwardly giving the impression that everything was fine and obviously just shoving it down. And in the end, I woke up one morning, and it was really when it reached that point of the pain just manifesting to make me just stop, step back, stop. So it's a protective response. And so that question is something that I always ask, now, never did before as a physio. It's apart from, okay, what did you do? But not what was going on in your life when the pain came on, as well as what did you do?
I know from my own experience throughout my life, when I have pain, I want to get to the point where we fix the pain. And
Yes.
I've been previously very resistant to, let's talk about your emotions. Let's talk about your stress. Well, in the past, I had not made the connection between stress, emotional issues, and pain. Can you speak to just the person listening that also would be like, okay, there's a pill for that, there's a procedure for this. Let's skip the part where we blame me for the problem and all the things I'm going under. Like, can you speak to that mindset? Because I've had it, and I can see where that didn't work for me. I took all the pills and got a lot of procedures, and none of that ever really resulted in any wellness. But we want that quick fix, and we don't want to be feeling like it's like we're causing this to ourselves. So can you speak to that a little bit?
And I relate to that myself because when I came across this work, I came across it in 2007. I'm 64 now, so I have spent a lot of my life blaming something on what was causing any pain that I had. And I would sometimes have hip pain, sometimes neck pain, sciatica, bowel problems, rashes, all sorts of things. And it was always a reason for it. And therefore, I would go to the doctor or a therapist. Well, in America, you talk about therapists being all therapists. By therapist, I mean a physiotherapist or another physical therapist. And nothing really got to the bottom of it. Although I didn't have chronic, ongoing problems, I had recurring problems, and something would pop up, then something else. And being that physio, people would come to me to resolve their pain. So this is a real shift, and it's not about blame in the slightest. Pain is a protective response. We learn from childhood. We learn, depending on how we grew up and what circumstances we were in, to shut down on how we were feeling, to cope. We learn whatever was necessary to cope in the situation we found ourselves in. And if we learned, let's say, that anger is dangerous, maybe because we observed it in family members, or we were told you should not be angry. Children shouldn't show their anger or whatever. And so we learn to stuff it down, and then that becomes a learned response. So then if there is some confrontation, rather than reacting to that, that might trigger us. That might trigger a physical response because it's it's almost like the protective response within us feels it's safer to have a pain than to fall apart emotionally or express our emotions. So this is a protective response that's actually allowing us to move forward with our lives or even stop and avoid what is perceived to be a dangerous something dangerous.
So what I'm hearing you say is that pain is a perception in our
Mhm.
body and sometimes can, I don't want to use the word distract. I don't think that's the right word, but it can be a shift from an emotional pain or fear or anger. And it just manifests because we're unwilling to look at it on an emotional level or deal with the thoughts and the beliefs and all of that. But it has to go somewhere. Like it's like
Yes.
almost like a game of whack-a-mole. And if we're real good
Yeah.
at whacking our emotions down and suppressing them, and I'm fine. Are you fine? I'm good. Everything is so good. I have no right to be angry. I have no right to be resentful. Like I am a privileged woman with no problems. Then the energy of that emotion that we're not processing has to go somewhere. And so what I'm hearing you say is that then it manifests physically. Is that accurate?
Absolutely. So it will manifest in whatever way is required at that time. And it becomes a distraction. It's not to cause a distraction because I don't think the brain could even make
Mm-hmm.
that decision, but
Yeah.
it is a manifestation of, yes, whatever's built up inside. And therefore, what we've spent our lives looking outwardly all the time, always sort of focusing on what's going on out there, and being seen to be in control and calm and living up to the cultural expectations, whether or not we had any challenges in childhood at all. It's living up to cultural expectations, family expectations, school expectations, gender expectations. And for example, women are supposed to be good, good and quiet and well behaved. It's a lot more acceptable for men to be angry than women to be angry. But what I wanted to point out as well is that it's not a decision, it's an unconscious, we might not even be aware. In fact, I had an experience of this myself literally a few days ago, talking to somebody, a man who was very challenging. And I felt, again, we'll probably move on to this, how important it is to tune in and notice when we're triggered, notice how we're feeling. I was well aware that I'd have been triggered. Because I had a very strict father who would raise his temper and raise his voice, and because I was a very shy child, it scared me. And I learned from observing and observing him with my siblings and maybe arguing. To me, that was very threatening. So I would shut down and go quiet. It became very good, and just became the quiet one, and trying to be perfect, trying to be good, so that nobody would be angry with me.
Yeah.
So I am still working years and years on. I'm still aware that at times, and I used to say it's an older man. Now I'm older. It's not an older man,
Yeah.
but it would be a man who's maybe I don't know, being angry or assertive, uh, a strong ego that will trigger me. But what I find now is that I'm aware of it. I'm able to self-soothe. I'm able to
Yeah.
deal with it, and then I know that afterwards I need to do some more work on me
Yeah. Well, I had
without
a
getting the back pain or a headache or something.
so it's I think what I'm just coming into awareness, and it's always a deeper level of awareness, is that our emotions live in our bodies, like it's an energy that's stuck there. I had a similar experience where it took me 3 days to realize I was a little upset about something that had happened. I had acted super cool, somebody didn't show up for an appointment that we had set, and then kind of blew it off like it was no big deal and we'd made it. And it took me 3 days because I really respect this person to acknowledge that wasn't very cool.
Yeah.
And once I did acknowledge it, like I don't have to be mad at her or feel bad about myself, but I had to bring it up into my conscious awareness and be like, oh, there was a rock in my shoe and I wasn't paying attention because it was such a subtle, small thing. So, how does those small unprocessed things that we all have every day because there's 1,000 things going on and we don't always take the time to process, how does that turn into pain? Is there a pathway for that, or what is your best explanation there?
As just a simple explanation, it's the more we ignore, the more it builds up. So it's, and the fact that we generally, most people do not tune inwards and notice how they're feeling until they feel the big emotion. So it's basically the term alexithymia is if we don't have, we're not unable to really recognize emotions, really feel the internal sensations related to emotions. And that has been highly linked with chronic pain and other chronic health conditions. And the better we can start, the better our felt sense, our interoception, so these sensations that are triggered with emotions or anything else, being able to feel our heartbeat, for example, or being able to notice when there's just a subtle shift. And often we're too busy and we're not aware of it. And I've been in the same situation as you, Colleen. And it literally, if we are so outwardly focused, or even if we're trying to be calm and deal with everything, unless we tune in and notice, they just get shoved down, either because they're repressed, because we've learned through past experiences it's dangerous to express something. So the brain will just that's it, will just become repressed so that we might not even know it's there. Other times we might suppress it, and that's a deliberate, right, you know what, I don't like feeling like that, I'm not going to go there again. Or it might be an avoided emotion, where we just get on with life and we don't really notice how we're feeling. But all these strengthen the neural circuits that are involved with this, and they become more of a threat. And so if something bigger then happens, and then if it, let's say in the past you, like for me, the neural circuits involved show that if anybody raises their voice, it's dangerous. Now there's an unconscious pattern within me because of my experiences that that's dangerous. Now we know that that has then become learned. That's a learned unconscious pattern within me. And so provocative, not provocative testing, but often if you have had, if something has happened and it's got something happens again, the brain predicts that. It predicts it and reacts as to what it expects should happen rather than actually what is happening. And that happens with pain as well, which is why we can use this understanding, for example, like provocative testing, where you can actually say to people, okay, so you get pain whenever you bend. So in your mind's eye, you're sitting there, but just bring to mind a time when you're bending, or imagine you're bending over and picking up a chair. And often that will elicit pain because this is actually the coded within us, within our nervous system as a protective response. And that could be a really good way for people to recognize, okay, so this isn't actually an emotion necessarily doing it. It's not necessarily a structural thing, but actually it's being triggered because these pathways have been learned, and then it becomes neuroplasticity. We can change these neural pathways, but they become learned and then sensitized, and therefore they're more easily triggered.
I find this fascinating, and I want to move into from the bridge from pain to actual stress. But before we do that, I feel like the audience probably needs us to enroll them with a little bit more example or proof of somebody that you've dealt with who has been coming in for some sort of chronic illness, be it pain or sciatica or I don't know, give me an example where doing this work, the somatic work to process unresolved energy in the body actually led to something that maybe their doctor and procedures and pills, and they've been struggling for years. Just can you give me a case study or an example, an antidote, if you will, of how amazing the transformation can be when you start dealing with the source of the problem?
Mm-hmm. And that might be through somatic work, it might be through just pain education, or journaling to express, emotional journaling, or expressive journaling. All those can help. Let me just think. And we've got quite a few of our practitioners have gone through this whole process of being a client, having struggling with chronic fatigue or fibromyalgia for many, many years. And then they've come across this approach, recovered. They are now, have now trained with SERPA and now work with other people using this approach.
Let's talk about fibromyalgia. I mean, how does that present? What is the beliefs? How is it normally treated? And what have you seen with, SERPA?
Well, certainly with fibromyalgia is usually believed to be a physical condition that's actually due to some physical cause, even though no known cause has been found. And yet we know that there's lots of studies that show, for example, people with fibromyalgia have often had past adverse childhood experiences. They often ruminate, they're in their head worrying more. They have a certain, often a particular personality that Dr. Sarno talks about, who's the professor that's work's built on. So, for example, a perfectionist, a caregiver, always doing things for other people, maybe overanalyzing, overly conscientious. Those things create a lot of self-induced stress because we're often giving to another person all the time. And that's why women get more fibromyalgia than men, because on the whole, women tend to be the ones that are doing things more for other people, that are the caregivers, very empathic and kind. So there's a tendency for those sort of people to get fibromyalgia. And it often starts with pain in certain areas of the body, maybe a bit of brain fog and some fatigue. There's no real diagnosis for fibromyalgia, so it's about ruling out any autoimmune conditions and then checking to see whether there are at least, I think it's 11 out of 15 certain points in the body that are tender. And it's all the major areas in the body that are tender. But no treatment is successful, no physical treatment, whether it's drugs, because what they're doing is treating the symptoms because they're not sure of what the cause is. And I can't tell you how many people I've worked with fibromyalgia with this approach that have ended up gaining their life back, being symptom-free and being able to get on with their lives. I'm just thinking back to one lady now as an example, who came to me with a diagnosis of fibromyalgia. And she had had problems for decades that had been getting worse. Also, her mother had fibromyalgia, so she believed it went in the family. She then came across our work, began to have a bit more of an understanding. She's an interesting case, actually, because the first time when she went to the NHS, they referred her to a psychotherapist for cognitive behavioural therapy. Now, luckily, that psychotherapist had been to one of my talks, the very first talk that I gave about this work. So instead of doing cognitive behavioural therapy, he did something more specific, working with the underlying emotional causes rather than looking at beliefs and behaviours and just beliefs and behaviours and things. And he used something called intensive short-term dynamic psychotherapy. And he was allowed to give us 6 appointments. I don't think he said what type of therapy he was using. He was supposed to use CBT. He used the other type. She went away absolutely fine, no symptoms, within about 6 weeks. A year later, she got in touch with me. And it's interesting because I remember she said to me that she came across me because a friend of hers gave her my book. And I remembered that friend as being somebody who came to me for physio, whom I suggested she read my book, and I think I gave it to her, and she wasn't ready. And she said to this lady, well, this isn't for me, but it might be for you. So this lady then came back to me, and what had happened was that through psychotherapy, she dealt with some of the underlying emotional stuff, but there was ongoing stress in her life. And she had had significant childhood trauma and trauma in her relationship that was ongoing. So this had helped in that moment, but she hadn't actually learned about what else she could do herself to deal with any ongoing stresses or any unconscious learned patterns that kept triggering her. And so when she came to see me, that's what we started working on. And she cried throughout her whole assessment, and she was able to do very little. And again, she ended up completely resolving her symptoms, using some emotional awareness and expression work, doing breath work, developing a felt sense, but really understanding that this was not a threat, working with her doubts and her fears. And she went on to make a very good recovery and maintained that. And
Yeah.
nobody would give her that diagnosis of fibromyalgia anymore.
Well, I'd like to dive into some of the misperceptions of stress, a stress response. You know, stress is, it keeps us alert. It helps us avoid getting hurt. It's slamming your foot on the brake, turning down the radio if it's too loud and you can't focus, grabbing extra food in case you get hungry later. All these things we just do automatically without thinking. How is that stress response becoming chronic where we're creating our own stress and it's not going away, which then is leading to these physical symptoms of pain?
I think that's a big question. It's a great question. But part of that is our lifestyle, the way we live our lives now, the pace of life that we never stop. Stress, there could be good stress, eustress, and there could be challenging stress. You know, the constant ongoing, push. Yes, it's stressful. And then it's about learning to deal with that. But there are also positive stresses. So, for example, I do cold water dipping. I do the Wim Hof dipping and the breath work, both of which challenge the stress response, but in a positive way. And I often feel like when I actually have a tub in our patio behind the house, and I feel like if I can get in that when it's sort of 2, 3, 4 degrees and stay there for a few minutes, then that not only is it boosting my immune system, but it actually means that if I can deal with that, I can deal with anything. So this is getting us used to being able to deal with acute stress and then be able to move on. Unfortunately, what happens is we have so many things that are impacting us all the time, and more often than not, people aren't pausing to take time out, spend time in nature, be still, whether it's meditating, whether it's just sitting quietly and looking out at the window or sitting outdoors and listening to the birds. We don't do that. If people will say to me, oh no, I relax in the evening. So I remember a patient saying this to me once and said, well, she did not accept that she was stressed at all. So I said, okay, so just apart from the triggers from the past, give me an idea of what's your day to day. What do you do during the day? So she gave me this. So the main thing was that she came home from work, they would cook their dinner and then sit down and watch telly all day. So I'm resting. No, you're resting your body sitting on that sofa for 4 hours. She didn't have time to do any of the journaling or meditating or anything because no, I'm too busy watching telly. Sitting watching television is a distraction from dealing with how we're feeling. And I'm sure many of us are triggered by watching things on the telly, but then we just ignore it. And then, because we're too busy involved, maybe in a thriller or whatever it is, rather than actually taking time to be still, to journal, offload how you're feeling, and just pacing ourselves a bit more. And people also don't realize that much of our stress is self-induced. So this might not just be lifestyle. This could be by our personality traits, by that having very poor personal boundaries, and being a real perfectionist. And I'm explaining myself by the way.
Yeah. Hi, me too. Mm-hmm.
I've had to do so much work on myself, and have done for 20 odd years, still a work in progress. But I would still have that tendency to be a perfectionist, that need to be in control, overly critical, worried what other people think. But that's more in the background now. And not only that, but if I feel like I've been triggered, maybe I feel like I'm writing something and then I'm becoming perfectionistic about it, I will recognize within my body, I'll pause and notice what's happening and deal with that. Now, having said that, there are times when, just like anybody else, I don't always walk the talk. And I remember a number of years ago having a deadline, and I worked from home. I could have taken a break, a 5 minute break, and then come back. But you know, I was so immersed in what I was doing, I carried on. My head started getting a bit thick, and heavy, but I just thought, I've only got another 5 minutes. And that 5 minutes was half an hour. By the time I stood up, I was so dizzy that I had to hold on to something to get to the chair by here. And then even when I was sitting down, I had to hold the sides to stop me from falling over. I was so dizzy. But I wasn't worried in the slightest because I knew that it was just that a protective response making me just stop, enough, just get away from that computer. And I'd ignored it. So I spent 5 minutes or so doing calm breathing, self-compassion, listening to myself, talking kindly to myself. It calmed right down, and then I took a break. And it was a learning opportunity, and I've never pushed it to that again. But again, we have to learn from our own experiences.
We do. I think of emotional hygiene a lot like physical hygiene. Like you have to
Yes.
poop, stop and go poop. Stop like resisting and I don't have time to poop. And then I have a stomach ache now, but I don't have time to poop. I deal with women with alcohol use disorder and they have a perception that they have a high tolerance for alcohol.
Mm,
No, you have a high tolerance for ignoring what's going on in your own body. You are
absolutely.
so outwardly focused and completely unaware of below the neck down. You don't know when you have to pee. You don't know when your friend made you mad 3 days ago because you're not allowed to be mad at that friend because there's a power imbalance or like whatever it is, like all these subconscious processes that are driving us to just keep going and not stop.
Mm,
And it's no wonder that we're afraid to stop because at some point we have a lot to unpack. Like I feel, of course, I try to walk the walk, but I feel like I do this on a regular basis. So yeah, I miss stuff and I push through stuff, but I don't let it go so long that I'm not aware. I enjoy it just like I like the feeling of pooping. I like that release. I also like the feeling of not carrying unresolved energy in my body.
yes,
Yeah.
absolutely.
And so, I wanted to just bridge that conversation with you, not knowing what SERPA was, but I help women with alcohol use disorder. And what I've been able to see from work like yours, from all of it, is when women think or when anybody thinks they have a drinking problem, we get this over response of like it's this life or death issue that you must immediately change your behavior and it triggers a stress response.
Yes, yeah,
And then
absolutely.
these people end up they're trying to change their behavior, they're failing to change their behavior, and it makes this stress response worse. They get caught in this cycle, and then they start believing they can't control themselves and that somehow relaxing in an evening is hard or complicated.
Mm.
And so I wanted to just, go into you've described the well understood aspect of neuroscience that is accepted and applied in different contexts, some better than others with stress related disorders. I actually think alcohol use disorder is a stress related disorder.
Oh, I do. Absolutely. No
Okay.
shadow of a doubt.
Okay. Yeah. And I'm getting amazing results with women by telling them, don't worry about your drinking. It will self correct if you begin to unpack your emotions, heal your relationship with yourself, and you don't have to worry about the alcohol situation.
Absolutely. And that links into the ACE studies, doesn't it? The adverse childhood experiences studies that, it's not just shown that the link between adverse childhood experiences and chronic illness in later life, especially the main killers, but in behaviors as well, like smoking and drinking.
Yeah.
And I mean, I've only worked with one person who was had the label of being an alcoholic and was very successful just doing the same approach. And I absolutely agree. This is the need to drink alcohol is the symptom. But
Yeah.
what and the need and the same with the focus. The more you focus on trying to stop drinking or trying to not do what you don't want to do, whatever, the worse it is. It's exactly the same with pain. The more focus you put on the pain, the more focus you put on trying to get rid of the pain, the more pressure you put on yourself. So I think
Yeah.
we both approach this in similar ways with self-compassion, with looking at the behaviors, looking at the habits as well. Because even today I had an email saying, why is it that, we, even though we know something's good for us, we don't do it. We just still do what we've always done because it's easier. It's an ingrained, learned neural pathway or
Yeah.
neural circuits involved with that behavior. And
Yeah.
our conscious brain is nowhere near as strong and able to. So we need to work on the underlying reasons for why we're behaving like that or why we have pain.
Well, and to speak, so the adverse childhood experiences, your ACE score definitely predicts, increased risk of a substance use disorder or anything
Yeah.
else, other problems. But there's also a subset of the population, I would be a representative of it. I didn't have a traumatic childhood. And so, and I have a privileged life, it's like I fart and somebody's fanning it. And how can I help you with that? And so what, what I have found is there, of course it correlates with trauma, but I think we traumatize ourselves in the disease of perfectionism, where I'm not
Mhm.
allowed to feel stressed because I don't have any reason. Like my parents, one of the things they used to say is, you don't have any reasons to complain. You don't have any reasons to be upset. You're not allowed to be angry, or I'll give you something to be angry about. That sort of train my subconscious mind to suppress my emotions. I'm happy. I'm nice. I have no needs. What can I
Yeah.
do for you and help you fix your problems? And so
Yeah.
I think perfectionism and those of us, and then we respond to our own emotions as though they are a problem. And that's that chronic
Mhm.
internal stress of, I'm not allowed to feel upset. I'm not allowed to feel
Yeah.
ashamed of myself. I'm not allowed to feel this. This isn't who I am. I'm better than this. And so it's
Yes.
not just the past. It's how we're taught to respond to our emotions.
And I think that's an important point, and I think it's not a small subsection. I would say that the large majority of people that come to me say, "Oh, no, I had a happy childhood. I had a happy childhood." But why are there? Then they've ticked all the perfectionistic traits. So no, we know they're called big traumas, big T's, and they're also the small T's, the small traumas, the fitting into the cultural expectations, the parents who were expecting you to do well in your exams and who were cross with you if you didn't. There's all. I don't know if you've ever seen Gabor Mate speaking,
Oh, I
but
love him.
he yeah, so he'll always find somebody in the audience, won't he, who says that they've had a happy childhood. And then he drills to find something to explain what's causing their problem now. And this is, you're right, it's the emotions and it's the behaviors and personality traits we have now. But I'm just as interested in, okay, that's why you're uh, causing self induced stress now, but why you like that. And it might be that they grew up with a parent, and let's say they're a perfectionist, a caregiver, a people pleaser, somebody who's a bit anxious. Maybe one of the parents was like that when they were growing up.
Yeah.
Or maybe they learned to not be like one of the parents, or they learned something in response to their parent
Yeah.
being like that. So, but we are all who we are because of our experiences in life, even if
Yeah.
there were no traumas.
Yeah, I don't know if it's Gab or Mate that says it's not it's what happened to you. Stop asking the question what's wrong. Start asking the question what happened to you. But then it's also how you responded, which is a unique amalgam of your own personal history. I know my mom, one time I was singing in the bathroom. I was 15 years old, killing it. I don't know who I was singing, but oh, and my mom was like, "Oh my God, would you please shut up?" And it wasn't abusive, it wasn't horrible, but what that did, like I internalized that. And my younger sister, who can't sing, like I can actually sing, can't hold a tune in a bucket, she'd be singing, and my mom would be like, "Oh my God, nails on chalkboard." And my sister would sing louder and laugh. And it's like the
Yeah.
same stimulus created different responses. I was much more, oh, I want everybody to like me. I was the oldest child. And so it's like so much of what happens to us, it's just neutral.
Mm.
It's just somebody said this, you felt that. But when you're not in the habit of flushing the toilet on your own emotions,
Yeah.
bringing them up into consciousness and then releasing them, you get all emotionally constipated in there.
Absolutely, which is why I love the fact that these days there is so much more information about how to bring up, children, bearing all this in mind and making sure that they can self-regulate and they are able to express how they're feeling. I mean, my children are in their 30s now, and I didn't bring them up that way. Luckily,
Yeah.
by the time they got into their teens, I was much more aware and definitely more able to listen and to understand more, but not when they were very small. And
Yeah.
I look now at, observe my niece bringing up her children, and she listens to Gabor Mate, she's read Dan Siegel's books, she's open to my work, and I look at the way she's bringing them up, and it's just wonderful, treating them all as individuals, listening to them. I'm sure she's not perfect in any way, but it's very different from how we parented in our day when we didn't know. We
Yeah.
didn't know that.
We were taught to manage our behavior,
Yes,
not our emotions, at the
definitely.
expense of our emotions.
At
We
the
were taught
expense of
to
our behaviors.
perform, be perfect, make sure everybody's comfortable. We were taught to manage our behavior.
Quiet.
And women my age, 50 plus, don't know there's a difference. They think if I feel anger, I'm going to burn the house down. So I can't feel this anger. Like there's such a
Absolutely.
disconnect for, that your emotions do not drive your behavior unless you're ignoring them. And then they do.
Yeah. And often we if we're ignoring them, we're not even aware of them. And I'm just thinking as I'm saying this, I don't think my husband would mind me saying this, but I remember doing an emotional awareness exercise on him, because I thought, I wonder if he is alexithymic, thinking he probably was. And we did this, and I remember, I won't go into detail, but I remember asking him to bring up something, somebody, think about somebody or something he loved, feel that emotion. What is he aware of in his body? Nothing. I then brought up somebody that I knew would make him feel emotional, and I could see it was making him feel emotional, and he was not aware of anything. And he said, well, I know I'm feeling sad, but he was not aware of any internal emotion. So that means that it all of that's being ignored. That then could manifest in all sorts of symptoms unless we start to really develop our felt sense. And it's just another sense. It's like we know if somebody becomes blind, we know their hearing becomes more acute, don't we?
Yeah.
And this is the same thing. I remember when I started learning reflex therapy, and I couldn't feel what was going on. If I prodded and someone went, ow, I treated that area. But after I'd been doing it for 6 months, the sensation in my fingers was so much better that I could feel a difference in the tissues. And it's exactly the same with felt sense, with the interoception. One of the exercises I give clients is something I call pause, breathe, feel, reassure. So that anytime they are triggered, it might be that they suddenly have pain, but it also might be that somebody raises their voice and they notice the response in their body. Any sort of trigger at all, to pause in that moment and go and be curious and go, okay, that's interesting, and to calm their breathing. So pause, breathe. So nice connected breathing. So really calming the breathing so we self-regulate and self-soothe. And then to notice internally, what are we aware of? Okay, so I'm feeling a bit of tension in my upper chest, but that's okay. It's all right. Allow it to be there. They say that emotions pass through the body in about 90 seconds if we let them. Otherwise, we shut them down and they build up and manifest. And even just talking in a very self-compassionate way, you're safe. It's okay. That's just something, an old trigger from the past. You're safe. The more we do that, the more we become aware when we are triggered. At first, it might take, let's say somebody has a migraine, it might be that they do this pause, breathe, feel, reassure when they start with a migraine. But often people with a migraine have an inkling it's coming on, maybe with an aura or something. So they can then do that pause, breathe, feel, reassure at that point, and they can often prevent it getting worse if they actually do that and they really start to pause and then recognize, actually, I need a break. Or maybe they journal about something. But the better they get, the more they develop their felt sense, which can take time, the earlier they can do something so that they actually do the pause, breathe, feel, reassure and address whatever's going on very early on, when as soon as that initial trigger's happened, or they ignore it, and then it will
Yeah.
build up.
I really like that I need a break. Pain is a message from the body that your body needs your attention. And
Yes.
if you ignore it, your body, it will build and build until you can't ignore it. Like
Yes.
it's
If the
really
body
that
just stop,
simple.
that's it. Stop. Mm.
Pain is a message and you can ignore it and push through. And I got a PhD in pushing through and drinking through it. Thank you. And but now, like the moment I realize, oh, there's like the littlest rock in my shoe, you pull the rock out of your shoe, you don't ever develop the blister. It's
Absolutely.
hard to walk it back when you've got an open wound blister and it has
True.
to heal, and that takes more investment. So, what I want to do
Mm.
now is tell me about SERPA so that somebody listening who wants to see a medical professional of any specialty, whether it be counselor or coach or a doctor or a
Mm.
physical therapist, how would they find somebody who can help them with a holistic point of view of what's going on for them really?
Yeah. Well, obviously we have a website, and we have two directories on our website. So the website is serpa.org. So that's S for sugar, IRP for beta A.org. So we have our directories of practitioners there. We have two directories now, those who are SERPA informed, so they can educate people who come to them, and they can advise and pass on resources and refer on as required, but they don't do any therapeutic work. For those people who have done the full 3-level training that we have, they go on and do the practitioner training, which is our level 3, and then they go on and do the more therapeutic work as well, and working and obviously there are going to be some people who maybe would benefit from seeing a SERPA trained psychotherapist, for example, rather than a SERPA trained physiotherapist. Some people would prefer to see a doctor, because obviously we have to make sure that anything more serious has been ruled out. So we
Mm-hmm.
don't just assume that a symptom that comes on is a mind-body condition. We need to be sure that anything more serious has been ruled out. Um, and and so we have doctors who are trained. We have physiotherapists, counsellors, psychotherapists, coaches. So it depends what people are looking for. And people can just look at the images on the directory, can go in and find out a bit more about their other work, because they've got their own professions, but others have gone on to do more training on the mind body side, more training on the somatic side, or trauma. So it's a variety. Most of our practitioners work online now, and most of them offer a free discovery call initially, because then at least whoever's contacting them can actually just see whether they feel they're a good fit for them.
I imagine that some of your practitioners, at least a percentage of them, are no longer working in traditional medical models where you get 5 to 7 minutes to treat a patient or a client, or there has to be a diagnosis code so that insurance can be billed and pills can be prescribed and everybody can get their piece of the pie of that patient. Is that are you an alternative? Um, are you a connection to kind of outside the system people?
Yes, and we are different in the US, definitely. Some of our practitioners are working within the National Health Service, but they struggle more because of the time. So literally 5 to 10 minutes with clients. So they would then be working more as SEPA informed. So they would give them some information, some leaflets, resources, recommend they go elsewhere. Um, the majority of the people working with us at the moment are private, because we have to be, until we have this, we've really made the difference, and we've been able to really change the whole concept around the treatment of chronic pain and other neuroplastic conditions. Then it is private. But having said that, when I left the NHS and went privately, that's when I began to notice more, because I was giving people longer. I learned to listen and observe, which generally, as an NHS physiotherapist, it's like they get in, they tell you what's going on, you treat them.
Yeah,
And I'll often say to people, I can help you, but I can't do it for you. This is about self empowerment, gaining agency over your own body, over your own life. And certainly we can help, but this is a very different relationship from going to a doctor, a physio, osteopath, to mend you, basically. But I think it's more like mentoring in the beginning and then coaching as they go through to really help them over any challenges, to learn from any challenges. But yeah, it is different in the UK. But most people are working privately. Some take insurance, some don't. Most
Yeah.
don't.
Well, that's the unfortunate world we live in, though. But going into the insurance, often it just creates a life cycle payment for a patient. You know, once you get,
Yes.
the more healthcare you get, the more you tend to need. And
Yes.
real wellness that leads you out of is sustainable. You don't need to keep going to the doctor when you have the skills to heal yourself. You just need help to get there. So
Absolutely.
I am so grateful for your time today. I so
Thank you very
appreciate. I
much.
know my audience will be so enthralled. Did I forget to ask you anything that you would like to mention?
I think the main thing is just making sure that people become aware to question what's going on,
Yeah.
and not just to push through. And if they have a condition, what was going on around the time that it came on, actually having things ruled out. And then we're able to actually rule in a mind body condition as well.
Yeah.
But it's not just assuming that
Yeah.
this is a real physical problem.
Yeah. And I will second that. You know, I've done thousands of discovery calls, and every single woman instinctively wants to tell me about what was going on in her life when the
Yeah.
drinking problem took root because it feels relevant. And they're just not
Yes.
used to anybody giving a shit and listening to them about
Mhm.
why, they think I'm just making this an excuse. I know that, I shouldn't, I've made bad decisions, and they think that they're making excuses for themselves when actually that's the first step. What was going on in your life when this developed? You're right. There's a
Yes.
reason why you're here. And
Yeah.
you haven't always been a problem drinker,
Mhm.
so
Mhm.
and giving them hope is just amazing. So
And
that's,
not even what was going on in that moment, but in that
yeah,
lead up, even
right.
in the months and months in the lead
Yeah.
up to that.
Yeah.
It's so relevant,
It's
isn't it? Whether it's in
fascinating.
drink or anything.
It's fascinating. And in the right hands, that can be a story that leads to healing. And in the
Yes.
wrong hands, we've got a narrative that you have a chronic, lifelong, terminal illness and you
Yes.
can never drink again and you're an alcoholic. And it's like the same situation in a different lens. One can lead to a lifetime of struggle and one can lead to freedom. So
Absolutely.
thank you for
Completely
being
agree.
here. All right.
Thank you for inviting me.
Thank you.
Thank you.